Someone had stuck a light bulb up this guy's ass, broken it, and stabbed him when he tried to escape, and he still escaped. They stabilized him, but he died of septic shock. Morgue workers, pathologists, medical examiners, etc. What is the weirdest cause of death you have been able to diagnose? How did you diagnose it? What's up, my man? Thanks for coming to another storytime with you boy Andrew. I'm so happy you could make it again. Since you keep coming for more stories, why not subscribe? This way you always get the newest storytimes right to your feed. Also, if you do, I'll buy you a free ice cream sundae. Hope you did that, cause I already bought the sundae. Anyways, let's get into the stories. Friend is an autopsy tech. Apparently it's not uncommon for cats or small dogs to eat the hands and face off a dead or incapacitated owner. His worst was an elderly woman who was paralyzed, but not killed, by a stroke, and her little dog ate all her exposed skin before she was found. He did her autopsy after she died several hours after being admitted to the hospital. Working the ambulance for a barricaded male. After an hour of standby, trying not to fall asleep, a cop bangs on our window frantically to call us into the house. Guy put a shotgun in his mouth, but must have flinched last minute and blew his face off. He was left with just a scream hole that was fluttering flaps of torn flesh, not unlike a predator mouth for a face. Only time I ever saw an nurse shriek at the sight of it. I'm a criminal defense attorney. Had a client charged with murder for essentially getting into a shoving match with a guy. No external bruising or scratching. No evidence of trauma anywhere. They opened his head and found a subarachnoid hemorrhage. Turned out he had a ton of booze and blow in the tox report. The coke had constricted the blood vessels and driven the blood pressure up, and the booze had thinned the blood out. When he bumped his head slumping back, that was all it took, and he blew out and was dead in less than a minute. Really sad case. Well, not a dead body, but I was a security guard at a hospital in Alaska. One of my duties was to bring deceased folk to the morgue, so I had a key to it. Get a radio call that some patient's wife wants her husband's wedding ring back. I assumed it would be on a deceased person. I go to the morgue to look for it. I look all over, no gold ring. I even open the coolers, no bodies. I then look in the fridge. Body parts and a little igloo cooler. I look inside that. It looks like very old banana peels. I glove up and pull some out. Turns out this guy had gotten his hand shredded in machinery. I had to get the mangled ring off his mangled hand and clean it off and go give it to him. Did an internship at the office of the chief medical examiner. Guy committed suicide in a river by wearing a backpack of rocks. Was found soon and didn't have much bloating etc. due to the submersion. Upon examination, he had a lung infection where his right lung had disintegrated into green liquid. We removed 1.5 liters of green fluid from his chest cavity. His left lung was fine. It was determined after looking at his medical records that he had been to the doctor's office 5 times before he committed suicide and that this infection had been going on for almost a year until it got this bad. Numerous doctors had overlooked it. Accounts from those who knew him suspected that he killed himself to stop the pain. I'm not an examiner but in the medical field, so I have heard firsthand of some bizarre causes of death. 1. Bee sting to the inside of the lung. A woman accidentally inhaled a bee, and it stung her. Apparently she was allergic. Took a week to figure it out. 2. Cause of death was gunshot to the chest and ruled a homicide, except he had been shot 3 decades earlier. A small piece of shrapnel from the bullet wasn't removed when he was shot, but he was completely fine for 30 years. Then it found its way into his circulatory system close to his heart, made its way into the man's right ventricle, and caused a heart attack. The man who had shot him was sent to prison for a few years and released, but was subsequently arrested and charged with murder. 3. A man with a very weird fetish put a live eel up his ass, and it tore a hole through his large intestine. Died. This isn't very uncommon, but what they had to do to save the mother was. I was doing clinical rotations and was told this story by an NP who used to work in India. So, nurse practitioner is helping a doctor deliver a baby in India. Well, when the baby was dropping into birth canal, its shoulder and head got stuck. The DR stuck his hand up to try and reposition the baby, but it wouldn't reposition. Baby died in birth canal. They still have to get the child out of the mother. Since the baby can't come out vaginally, they opt for a cesarean. The mother gets opened up, and they still can't get the baby's head and shoulder unstuck. Try everything. They end up having to behead the child, remember child is already dead, while in the mother. Take the body out through cesarean, and mother has to deliver baby's head. Edit. This was decades ago, keep in mind. If the doctor didn't decapitate the baby, mother could have easily gone into shock and died. It is gruesome, but his quick thinking saved the mother's life. I don't know if I would want to live after that though. I'm a friend of a coroner's assistant. He spent a few months there. He said his craziest experience was when a man came and apparently expired. He was a little vague about how the guy ended up on his table with the coroner, but I'll chalk it up to being early in his career. He starts to do a standard Y incision on the torso, he stops early on. He noticed that the guy had slight active vitals. He looked at the mortician present and says, "Oh duck, this guy's alive." They determined the best way to resuscitate was to do an adrenaline shot. Now apparently he was declared dead, but had something akin to puffer fish poisoning induced to his body. Anyway, the guy comes to, screaming like a maniac and with his chest partially sliced open. He described the whole thing as surreal. Edit. He wasn't a mortician's assistant, but rather a coroner for the city. My bad, my memory's dumb. EDIT2. Alright, a lot of people are calling BS, so I went and asked the man again and he'll post my Q into here. Me, I was telling the story, and they called bullcrap. Some are citing they'd be able to read his vitals before he got to you. How'd he get on your coroner table? Friend? He was rolled in, didn't ask where he came from. Me? Who was he rolled in by? He was just assumed dead and you guys started cutting? Friend? Transport tech like every other and they don't come down unless they're sure someone's dead. Me? So it was a slip in the system that you were able to find him alive and resuscitate him via adrenaline shot? Friend? I guess someone dropped the ball. So there it is. Hope that helped. Work in a nursing home rehab. Guy essentially died from pooping. He pushed too hard, blood pressure dropped, and that was it for him. This is actually pretty common. Edit. So there have been a couple of requests for explanations. Here's what I posted further down. Major edit. You aren't going to die from pooping. The following is a discussion about why people with bad hearts, limited cardiac output, and damaged vocal cords. Vasovagal syncope is totally boring from a medical perspective. I don't even treat it. If the normal person faints from pooping, their heart kicks back in like it should, and you keep on living. You aren't going to die. Yeah, awesome question. So I have been wondering a ton about it. I work with babies and children born with heart problems, and it's actually pretty common to see these little guys get into big trouble when they throw up or bear down to try and pass a poop, especially if they aren't quite normal to begin with. As I'm sure you know, the phenomenon of vagal-mediated syncope, common faint, is pretty well described. A quick synopsis of how I think of it is as follows. The heart maintains adequate blood flow to the brain through a carefully regulated system of arterial resistance, heart rate control, and indirectly how much blood the heart receives squeezes out, preload. A faint happens when the heart does not provide adequate blood flow to the brain. The regulation on this needs to be pretty good obviously, because when we stand up the demands for output are different than laying down. Similarly, we need more output when we are exercising and so on. So, heart output and blood to brain need to balance, but it can mismatch. This can happen for a couple of reasons. 1. The fainter stands up too fast, and the brain can't tell the heart fast enough that it needs more output. So the fainter stands up, but the heart doesn't turn up the rate squeeze, and so inadequate blood flow makes it to the brain. The heart catches up eventually, but not before the fainter hits the ground. 2. Same thing happens, but instead of too little we see too much response. The system in charge of regulating arterial tone over responds, and the brain doesn't see enough blood again. Floor. 3. The system inappropriately slams on the brakes on the heart. The nerve that is in charge of backing off the heart is called the vagus nerve. It usually does a pretty good job, but it's networked into all our gut, as well as a litany of other things. If you stimulate this nerve elsewhere, it will incidentally slow down the heart. So increasing the pressure in your abdomen will similarly slow down your heart. It's not the only reason that bearing down is a problem though. When you increase your intrathoracic chest pressure, you also drop the amount of blood returning to the heart. Why? Well, if you think about the blood going back to your heart as a pipe, squeezing the chest and abdomen is the same as pinching the length of it, so breathing out hard or pooping makes your heart get less blood. Alright. Vagal syncope 101 completed. Thanks for watching. What did you think of the story time? Let me know in the comments below. If you liked the video, smash that like button and subscribe so you don't miss any more story times.